welcome in person and online. It's great to be here in Sweden. Thank you very much to the local host, Michael, Slobodan, and Elizabeth, who have been organizing the conference along with Tamsin and Elba. So thanks for all that. So it's great to see the turnout, quite incredible. So please, come back next year and the year after, and you are very welcome to get all the information available from Tamsin. So I just want to say a few words about the journal. So we have a peer-reviewed journal, the International Journal of Health, Wellness and Society. It's also indexed in Scopus. So I would like to welcome you to submit your papers, if you haven't already submitted to other journals, to the journal. And in addition, we actually organize each year a special issue on the key focus of our conference. So it's always a year later, but this year, Health for Democracy and Democracy for Health, for which Michael is going to actually give you a few more details. But if you feel that your paper is really very close to that theme, we would be happy to talk to you about this. Michael can give you more information about the special issue that's coming out. So again, I just don't want to take any more time, because I know that Michael's got a lot about the actual research focus, but also about Malmo. So I will be happy to pass the floor to you.
Sorry, Michael, before you jump in, I forgot to say thank you to our Spanish Language Research Network chair. Did you want to come up and just welcome people and say hello? Sorry, Michael. Thank you. Thank you.
Hi. Good morning. Buenos días. Angélica Bendaño del área español, y quisiera dar la más cordial bienvenida a todos los congresales, especialmente aquellos que han concurrido desde lugares más lejanos. Nosotros somos desde Chile, venimos una delegación importante desde la Universidad de Concepción de Chile, a 500 kilómetros de la capital, y además queremos incorporar, ¿cierto?, a todos los compañeros de habla hispana en nuestras sesiones, invitarlos a que participen en tanto en las conferencias como en las sesiones plenarias, en las comunicaciones en grupo. Y por supuesto, esta es una tremenda oportunidad para poder compartir experiencias, gestionar conocimiento, movilizar conocimiento y fortalecer las redes, que son tan importantes en el día de hoy. Así que hemos hecho un largo viaje, un largo camino. Estamos muy emocionados de estar acá, y agradecemos, por supuesto, a la Universidad de Malmo y a la Common Ground, que es quien moviliza todos estos grupos a través del mundo. Así que bienvenidos y bienvenidas todas quienes estamos en el área de español. Muchas gracias.
Thank you. Thank you so much. I'll pass over to you now, Michael. Sorry about that.
Okay, thank you very much. So in addition to the thank yous to Tamsin, to Albert, to Luis, to the entire network, also very much thank you to all of you for being here. And obviously you've been very good this year because you have fantastic weather. This is a wonderful day on which to enjoy the Öresund. The conference theme that we've chosen for this connects several different fields, which fits very well, not only with the network, but also Malmo University. Malmo University is a relatively, comparatively small regional university, but because of its interdisciplinary, but also its transdisciplinary character, it has much more impact, as you'll see. In many cases, it's at the level of the very highest universities, and we're very, very grateful to have you as part of that story. The conference theme, Health for Democracy, Democracy for Health, of course, speaks to, on one hand, we know from political science that there is a correlation between regime types. So liberal democracies tend to correlate with better healthcare outcomes, also better welfare outcomes for people. But also democracy is a notion which is used in healthcare. This varies between, on one hand, just a basic, very narrow story of choice in healthcare, to more of a discussion about how do you have informed choice? How do patients get to deliberate over, to understand what their healthcare needs are, and also broader understandings of our health and welfare, to, you could say the more advanced, demanding approach, which is where we're in the direction of co-creation of healthcare as well. But also, of course, when we think about societal determinants of healthcare, when we think about housing, when we think about education, when we think about job security, then we also see that healthcare and health is something that becomes very unavoidably political as well. It's very hard to do research in this field without at some point engaging with very messy, very complicated political discussions. On the other hand, of course, we could see how healthcare is also a way where we can sometimes bring more maturity to these discussions. So we can sometimes step outside of the political spectrum and just do what is good for humanity and good for the world as well. And of course, today we are seeing also rapid change in healthcare the world over. We have, last year, there was a theme around digitalization. We now often talk about this in terms of these very abstract terms like artificial intelligence, and this is many, many different things. But it's important, of course, when engaging with this kind of research as you're presenting here, to remember, of course, that at the heart of this very abstraction within healthcare now is, of course, the humans involved, that it is fundamentally political. That's also a little sneaky plug for an event this afternoon. So along with the Spanish plenary at the same time, for those who aren't speaking Spanish, then we also have an event upstairs where we're going to be having a workshop around AI in healthcare, which you're very welcome to attend. That's 2 o'clock until 3 o'clock. So again, welcome to Malmö University. We're thrilled to have you here, extremely honored, privileged to have your presence in this room with us, and also for those online. We're looking very much forward to the discussions that are coming in today and tomorrow. And on that note, I would like to introduce my colleague and someone who I respect greatly, Anas Kortop. Professor Anas Kortop is Dean of Health and Society. So he's a very influential, very important figure within the theme of this conference as well. And without further ado, Anas.
Thank you, Michael. So just formally on behalf of Malmö University and the Faculty of Health and Society, but also the other associated faculty of Culture and Society, welcome to this international conference here in Malmö, Health for Democracy, Democracy for Health. Yes, I'm the Dean for the faculty, and but I'm also a clinical occupational therapist and a professor in occupational therapy. I just want to say that, so I'm and try to keep that research going on as well. Also, welcome to Malmö and welcome to Sweden. You are not in Denmark, don't believe that. You are now in Sweden, and Malmö have been a part of Sweden for hundreds of years. Malmö is the third biggest city in Sweden, approximately 500 citizens or something like that. But we also highlight that in Malmö, we have 170 nationalities in this city. So even though you are locally here, you're also part of the global society as well. And this large diversity we have in this city, you will see that if you have time to walk around, you will hear different languages, you will see different colors, different clothing, and a variety of different food. So take that as an opportunity as well. And of course, the diversity in a city like this is also associated with some, maybe also challenges as well. I will not focus on that now. As Michael said, we know that health on a surface level is associated well with democracies as compared to non-democracies. But I think that we all who are part of democratic countries can also say that that doesn't mean it's a happy valley in relation to health. And we see more and more of this also in our countries, that health may actually not go up and up, but we also see that the health and also ill health, of course, is not evenly or equally distributed within our countries and cities. And that is, of course, a challenge. And a few years ago, and I think you have done the same in your countries or cities, we looked here in Malmö in relation just to diabetes type 2, how that was distributed in the different neighborhoods. And the prevalence was like 3 times higher if you just cross the street. I mean, literally, but you get the idea. There are challenges here. How does that influence how we also work with this. Democracy is about power, but health is also a lot about power. And the keynote speaker here, Margareta, a colleague of mine, will give you some important insights how we can think about using the same ideas in democracy with empowerment processes to people, distribute the power to the people, how that can also be linked to how we think about health and health interventions. And this is something, as I also represent the health sciences, is also something that is coming more and more in different ways, how we can empower patients, clients, etc., to be a part of the health processes. And Margareta will tell a little bit more about the hardcore empowerment processes, and some good examples as well. Yeah, I will actually not take so much more time, but I would like actually to end this welcome speech, giving the voice to a person who I think actually captures the essence about what health and democracy for health, how they are intertwined. And this is a woman who was part of the research and the processes that Margareta will talk about. She was part of the physical activity lab that was developed among the citizens, primarily women from Arabic-speaking Muslim countries in this neighborhood. And we followed them, and we of course also evaluated this from with the research hat on in different ways. And this citation comes from her in a focus group where they reflected upon the processes of being part of this process and so on. And I hope it can speak to you in the same way as it speaks to me. And this linkage between health and democracy, and also to, at least for me, think about, okay, this is why I keep being engaged. In the end, it felt like we were being listened to, that we meant something. Yes, I actually started to believe that I mattered. Enough said. Thank you, and again, welcome.
Just shift the camera.